A lot of times we get an ultrasound report showing there is a loop of cord around the baby's neck. Now, when we get such a report, what implications does it have on the pregnancy? So, you have to understand that the baby is inside the amniotic fluid and the cord is also around there. And both the baby and the cord are floating and swimming in this fluid. So, the baby can entangle a loop of cord around its neck or on any other body part of the baby. But in the ultrasound, we generally see a loop of cord if it's around the neck, but there could be the loop around other body parts as well. Now, what happens is if the loop of cord is tight or if it is a short cord, then जब हमारा delivery का time होता है, when the mother is going through labor, when the head has to come down the birth canal and has to deliver, at that time, when with the contractions, the baby is trying to move down, sometimes a short cord could cause a problem because it may not allow the baby's head to come down, and even with the contraction, if it's coming down, it could pull it back up between contractions. Another problem that sometimes if it's a tight loop of cord around the baby's neck, then with every contraction, the baby's heartbeat might dip. Now, these are the two conditions in which we may have to do an emergency cesarean section, but we easily monitor for these things in labor anyways, because we do monitor your heartbeat during labor pains, and if the heartbeat dips, then anyways we'll be doing a cesarean section. Also, we will monitor the baby's progress and its descent as we do an internal check. And if we feel the baby's head is not coming down, then also we do a cesarean section. So that is the reason we don't specifically look for cord just before you go into labor to check whether this will pose a problem in delivery. Because a lot of times we have patients who have a very long loop of cord, and if it's only a single loop, it is a very easy delivery and nothing really actually happens. In fact, a lot of times we deliver a baby and we see there were 2 loops of cord around neck and we had never even noticed it on ultrasound. So we don't have to really worry about the loop of cord unless if it is multiple loops of cord or if they're tight loops of cord on ultrasound. That could sometimes lead to us doing a direct cesarean section. And the only thing as a parent, what you have to do is keep a good track of the baby movement. So if you feel that your movements are less, then that needs to be evaluated. Thank you.